I'm sure everybody in this room knows somebody that has experienced or gone through cancer, or more specifically, breast cancer. Personally, I had an aunt pass away when I was 4 years old from breast cancer, and recently, about 3 weeks ago, my other aunt was diagnosed with stage 3 of breast cancer. Today I'm going to be talking to you guys about the risk factors of breast cancer, the symptoms, and the possible treatments for breast cancer. There are many risk factors that lead to breast cancer. Breast cancer risks can either be controllable or non-controllable. Some of these risks include heredity, weight, age, gender, alcohol consumption, and exposure to radiation. Heredity is the passing of a specific gene from a first-degree relative. A first-degree relative can be either female or male. An example of a first-degree relative would be a sister or brother, a mother or father, or a son or daughter. Although breast cancer is most commonly found in women, men can also be diagnosed with breast cancer. According to DoSomething.org, a man's lifetime risk of developing breast cancer is about 1 in 1,000 chance, but it is still possible. Through heredity, you are inheriting a specific mutated gene. This gene for breast cancer is the mutated gene of BRCA1 or BRCA2. According to CDC.gov, the BRCA gene is used to repair damaged DNA. Usually, this damaged DNA is found in breast cells. If the DNA cannot be repaired with this gene, the BRCA1 or 2 gene will destroy the damaged cells. According to nationalbreastcancer.org, 0.25% or 1 out of every 400 people carry the mutated BRCA1 or 2 gene. Breast cancer is most commonly found in women. These women that develop breast cancer are usually at the age of 40 or older. According to DoSomething.org, about 95% of women who develop breast cancer are 40 years or older. Once a woman's breasts are formed, the cells are still in their immature state. Because these cells are immature, they are more subject to react to estrogen levels. The cells are more likely to react to estrogen levels until a woman's first pregnancy. Once a woman has been pregnant for the first time, their breast cells are mature and they are not likely to react to estrogen as much. Women who cannot get pregnant have a higher chance of developing breast cancer because their breasts are constantly in an immature state. MedicalNewsToday.com says that as you age, your cells in any part of the body are more likely to have abnormal changes. Now that we have discussed the risk factors of breast cancer, I would like to talk to you about the symptoms that follow. Someone who is diagnosed with breast cancer can experience no symptoms, some symptoms, or multiple symptoms. These symptoms can be physical or mental. According to CDC.org, the most common symptoms are skin changes. Some common skin changes from breast cancer are swelling, redness, a change in the size, shape, or color, and just general pain in the breast area. A reason for swelling and change in shape or general pain is due to lymph nodes in the breast swelling because of the cancerous cells. Another reason for swelling would be the fluids in the breast are building up and are blocked, and they can't flow as commonly as when there is no cancerous cells in the breast. Not only does breast cancer affect a person physically, it also affects them mentally. According to Conrad, some common mental symptoms are fatigue, insomnia, depression, and cognitive disturbance. Certain treatments, like cell treatments or cell therapies, can cause a patient to lose their appetite, become depressed, and cause them to not be able to think straight. Now that we have discussed the symptoms, I would like to discuss the possible treatments for breast cancer. Depending on the person and the type of cancer, including the stage, there are multiple types of treatment options. Most common is surgery. This is where a doctor will cut out and remove the cancerous tissue and cells. According to CDC.org, there are 2 basic types of breast cancer surgeries. The first type is a lumpectomy, and this is where the doctor will try and save the most breast and cells and tissue. There's also a mastectomy, and this is where the doctor will remove all of the tissues and cells found in the woman's infected breast. When you have a surgery that removes all of the breast tissue and not just the cancerous tissue, there is a lesser chance of the patient having a cancer relapse. This is the most common choice for women who are diagnosed with breast cancer. Another form of treatment option is therapy. There are multiple types of therapy for breast cancer. The most common type is chemotherapy, and this uses one or more anti-cancer drugs to kill the damaged cells in the woman's breast. The second type of therapy is hormone therapy. This is where doctors will use hormones to fight off and kill cancer cells. There is also radiation therapy, and this therapy uses radiation to kill off the cancer cells. When a patient chooses to use a therapy treatment, they may use multiple forms of therapy to be most effective and efficient. Others may choose to use surgery and then therapy if the surgery is not as effective as they had hoped in removing the cancer. All forms of treatment come with positives and negatives. When choosing a treatment, it is important to consider the person receiving the treatment. Multiple types of therapy and treatments may be necessary for a certain patient. According to breastcancer.org, breast cancer deaths have been decreasing since 1990 because of early detection, better screening, and an increase in awareness and better treatment options. In conclusion, I hope that I have successfully informed you about the risk factors leading to breast cancer, the symptoms that follow being diagnosed with breast cancer, and the possible treatment options.